Good afternoon, everyone. My name is Linda Hughes. I'm Chair of Alberta Health Services, and I'd like to welcome you to the last public board meeting of 2017. It's been a busy and productive year for everyone within our organization, and I'm sure it's been busy for all of you here as well. As we enter into the final days of 2017, I hope everyone gets an opportunity to relax, recharge, and enjoy the company of your loved ones. Albertans understand and appreciate the importance of hard work, and as a healthcare system, we also want to remind Albertans, including our own staff, physicians, and volunteers, that it's also important for your physical and mental well-being to take some time to unplug and unwind. So I wish all of you a happy and restful holiday season ahead. We have a full agenda today, and I'll discuss that shortly. But before I do, I'd like to talk about 2 or 3 things from the last month. First, I'd like to congratulate my colleague on the AHS board, David Carpenter. Last month, he was recognized with a Senate 150th Anniversary Medal for his long and distinguished record of public service. The commemorative medals were created for our country's 105th anniversary and are awarded to Canadians who make a significant contribution to their community through their generosity, hard work, and volunteerism. David has a long career of doing just that, including as board chair of the Workers' Compensation Board and longtime mayor of Lethbridge. So on behalf of everyone on the board, David, congratulations for that. Last month, AHS President and CEO Verna Yu traveled with several members of the AHS executive and senior leadership teams to the Kainai Nation in southern Alberta. They went to personally apologize to the community for last summer's racial slur incident involving 2 AHS employees who are no longer with the organization. Verna spoke during an assembly at the Kainai High School and extended an apology to Ramona Bighead, a school principal in standoff, to the Kainai Board of Education, and to the Blood Tribe Nation. We have a video that shows what went on at that event, if we could show that.
I want to keep trying to make our world better, our tribe better, that no one goes hungry. Everybody gets a nice warm bed at nighttime. Let us treat all people equally, our white brothers and sisters, ethnic groups. We're all the same. Thank you very much for coming here. I hope you enjoy
We accepted nothing more than an opportunity to apologize to Ramona, to the Kainai Board of Education, to the Blood Tribe Nation, and to all of you for the racial slur incident of last summer involving 2 Alberta Health Services employees. And I'm not going to repeat what was said because we know how hurtful these words are. I don't want to give these words any more authority. Where I want to place the power is within the power of our minds, our spirits, and our hearts, so that we can arrive at a place of reconciliation. We would like to present this to Ramona Bighead as principal of the school.
For the first time in a long time, I don't know what to say. And my family that know me know that's rare. Because I'm really touched. Everybody felt for me, and I think the reason why everybody felt for me was because everybody knew what it was like. It triggered so much within all of us. And I kept telling people that it's not just about me, Ramona Bighead. It's about all of us. I was proud of the fact that you guys realized too how important it was to act. You know, it made me feel like I was somebody.
Patients may come from different ethnicities and have different skin colors, follow different customs, and practice different faiths. Yet when you're treating illness or injury, you quickly realize that we are all but one, and we have much more in common than sets us apart.
Verna described last summer's racial slur incident as a low point for Alberta Health Services, and it was a low point. But I do believe our leadership responded appropriately in the aftermath of the incident, not just by terminating the 2 employees involved, but by looking unflinchingly at the root cause of systematic discrimination within our organization and seeking ways to address it. The visit to the Kainai Nation does not represent the end of the chapter in our organization's history. Rather, I hope the visit will mark the start of a new beginning between AHS and Indigenous peoples. Thank you, Verna, for spearheading the visit and for your efforts to ensure AHS treats all Albertans with dignity and respect. And finally, AHS received some welcome news last month. In recent years, our organization has been focused on improving both workforce engagement and the workplace environment for the 130,000 plus staff, physicians, and volunteers who work for AHS. Being named one of Canada's top 100 employers for 2018 suggests we're moving in the right direction. It's also good for Albertans, as the top 100 recognition will help AHS recruit the best and brightest people to our organization and to the province. So congratulations, everybody involved. Now on today's agenda, and it's a full one. Could I ask someone to move approval of the agenda? David, seconded. Brenda, all in favor? Thank you. Declaration of conflict of interest. Does anybody have a conflict of interest you'd like to declare at this time? All right, seeing none. And you've all seen the minutes from our last meeting, September 28th. Any issues, questions to raise? No? Could I have a motion to approve? Hugh, seconded. Marlis, all in favor? Carried. Thank you very much. Now I'd like to pass it over to Verna.
Thank you very much, Linda, and good afternoon to everyone. Like Linda, it's really hard to believe that this is going to be our final board meeting of 2017 and that it's almost over. So I'd really like to take the opportunity to publicly thank our staff, physicians and volunteers for all the hard work and dedication over the past year. Each and every day they live our organizational values of compassion, accountability, respect, excellence, and safety, and each and every day they go the extra mile to provide the best possible healthcare experience for Albertans. So I'm very grateful for their efforts and their passion to help others, and I wish all of them and all of you a time of joy, happiness, and relaxation over the holiday season. Of course, the holiday season is also a time when many Albertans think about those who are struggling and take steps to help out those in need. Albertans are generous, they're compassionate, and we really see at this time of year through donations to charities, community agencies, and food banks. And I'm very proud to lead an organization with people filled with a similar spirit of giving and compassion, and who work year-round to extend a helping hand to Albertans in crisis. Today, I'd like to highlight an AHS program that's helping many struggling Albertans to secure the medical and social supports they need in order to get off the streets, secure safe housing, and find employment. It's called the AHS ID program, and as the name suggests, the program helps Albertans secure government-issued identification and personal health care cards. This is important work. Over the years, healthcare providers have noted that a lack of government-issued ID and healthcare cards is a significant barrier to accessing services. So AHS has partnered with Alberta Health and Service Alberta to create a program that walks Albertans through the process and fast-tracks their application so that they can get ID within days and not weeks or months. The AHS ID program was launched as a pilot project 3 years ago, and a man named Larry Onek was among the first people to receive assistance through this program. We recently caught up with Larry to see what this has impacted for him and since he's acquired his ID through the healthcare card through the program, and what has changed over the last 3 years. So let's take a look.
My name is Larry Onek. I'm a window installer. I also a client of Alberta Health Services. I was in the hospital and I don't know if I'm gonna get well because I've already had 3 relapses and I've been homeless and for 4 years, and I'm wondering, I basically got to give up because there's no other way through.
The reality is many of our clients want the ability, they want to lift themselves out of the situation they now find themselves. Their barrier to accessing the services that will allow them to do that is the lack of ID. As a result of getting their ID and their healthcare card, they can now access community services, diagnostic services, addiction support, methadone treatment, can access psychiatrists and a range of services.
So I'm out there on the street. I have no options, basically, unless somebody is able to show me the options, because get well as get the ID, and the right person to be able to walk you through it, and the right agency to walk you through it, and Alberta Health Services was my answer. And all I had to do was stay consistent, listen to the teachings, and voila. Today, I'm driving, I have my license, I am married, I have a son, I have all the freedom I need. And as a Canadian citizen, I can also pay my taxes. That's amazing for me.
The credit goes to a wonderful, dedicated, compassionate team. Without them, we wouldn't be here today. You know, at the end of the day, we have the opportunity to make a difference in the lives of many on a daily basis.
I see lots of people on the streets today who are going through the same thing. And I always tell them, look, don't give up. Look for Alberta Health Services. They'll be there. The job they're doing is getting people off the streets and giving them a new life.
We had a client who cried, looked at his ID and said, I'm a person. And it was a hug fest.
So it's absolutely heartwarming to see how well Larry is doing, and I'm extremely proud of the AHS ID program. This work really embodies what patient and family-centered care is all about. And as healthcare providers, we need to look beyond the immediate medical needs of a patient and take the time to really understand and address the other underlying needs that are contributing to regular and repeated use of the health system. I'm grateful to Larry for sharing his story with us, because it's an outstanding example of what's possible when AHS and our partners work together to address a patient's medical, emotional, and social needs. The AHS ID program has the power to transform lives, and it's also helping the healthcare system. It's estimated that across Canada, 5% of the population utilizes 66% of the healthcare resources. In other words, 1 in 20 people use 2/3 of all healthcare resources, and this impacts healthcare access and health system sustainability. With a more holistic, patient-centered approach to healthcare, we can improve those numbers. We can work with our partners to address the needs of Albertans who are struggling, giving them the best opportunity to stay healthy, enjoy a better quality of life, and have less need for healthcare services. I want to thank everyone involved with the AHS ID program for doing this important, life-changing work, and for expanding the program to more communities across the province. And finally, I'd like to thank all of you for your continued interest in Alberta Health Services. AHS belongs to all of us. We want Albertans to know that we're doing this because we continue to face challenges. We believe we're evolving into a high-performing learning healthcare organization that we strive to be. We're very proud of what we've achieved in 2018 or 2017, and we look forward to what we can do in 2018. So happy holidays to all.
Thank you, Verna. So moving along in our agenda, if we could hear from the Human Resources Committee, Richard?
Good day, Madam Chair. The Human Resource Committee met on November 22nd. It received its regular quarterly report on our people's results, as well as receiving a labor relations update. New items considered by the committee included a comp review of non-union exempt staff employees, succession planning for certain roles. We got a briefing on what you just referred to a little bit earlier, Canada's Top 100 Employer Award, and the related communications plan. And we discuss amendments to the committee's terms of reference. The committee proposed changes to its terms of reference, which were subsequently passed on to the governance committee. The committee did not have any items that required approval by the board. Thank you.
Thank you, Richard. Quality and Safety Committee, Brenda.
Thank you, Madam Chair. The Quality and Safety Committee met on November 22nd, 2017. The committee received an update on improving health outcomes and an update on the priorities and initiatives of the Addiction and Mental Health Strategic Clinical Network. The committee also received a patient safety report and a review of hospital-acquired infections risk. The committee was asked to consider proposed changes to the Quality Assurance Committee, QAC, structure of AHS. In 2010, the AHS Board approved the AHS QAC structure, and all modifications to the AHS QAC governance structure require the approval of the AHS Board. The committee considered and recommended board approval of proposed name changes of certain QACs to reflect operational activities and the standing down of the Cancer Control Alberta Community Oncology Quality Assurance Subcommittee. Accordingly, I move that the Alberta Health Services Board approve, number 1, the QAC name changes as considered by the board and that will be posted on the public website with this resolution. And number 2, the standing down of the Cancer Control Alberta Community Oncology Quality Assurance Subcommittee of the Tom Baker Cancer Centre Quality Assurance Committee. I so move.
Thank you. And do we have a seconder? Marlis? All in favor? Okay, that's carried.
The committee currently has one external committee member, namely Mr. Gord Winkle. The board is responsible for appointing external members in accordance with the committee's terms of reference. The board has decided to reappoint Mr. Gord Winkle and to appoint Dr. Brian Postal as a new external member of the committee. The board is very appreciative of both individuals' willingness to participate on the committee. Accordingly, I move that the Alberta Health Services Board approve the reappointment of Gord Winkle for a 2-year term and the appointment of Dr. Brian Postal for a 3-year term to the Quality and Safety Committee commencing January 1, 2018. I so move.
Thank you. Seconder? David? All in favor? That's carried. Thank you. David, Audit and Risk Committee.
Thank you, Madam Chair. The Audit and Risk Committee met on November 23, 2017. Standard practice is that the Office of the Auditor General and KPMG are guests at the meetings in their role as external auditors of AHS. The committee discussed various audit matters, including the OAG General Audit Plan, second quarter financial report and forecast, interim report on internal controls over financial reporting, internal audit report and monitoring payments against contracts for pharmacy services, and the Enterprise Risk Management Quarterly Summary Risk Report and Risk Register Refresh. There was one item presented at the committee to be considered for board approval. The committee received an updated internal audit and enterprise risk management team charter to recommend for board approval. The update addresses the new responsibility of the Chief Audit Executive to provide provincial oversight and leadership for the audits of quality and compliance with continuing care health services standards at continuing care sites. Accordingly, I move that the Alberta Health Services Board approve the updated internal audit charter as reviewed by the board.
Thank you. Do I have a seconder? Hugh? All in favor? Carried. So, put your other hat on. Finance Committee. Thank you, David.
Thank you again, Madam Chair. The Finance Committee met on November 23rd, 2017. The committee considered 7 items for recommendation for approval of the board. First, the 2017-18 second quarter investment report. As mandated by AHS investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS investment portfolio on a quarterly basis. The Regional Health Authority's regulation and the AHS investment bylaw describe the requirements for the board to approve or ratify by resolution AHS investment decisions. The committee was presented the September 30th, 17 second quarter investment report and recommended that the board ratify the transactions. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions described below. 1. As at September 30th, 2017, AHS held restricted and unrestricted funds managed by Phillips Hager and North Investment Management and Manulife Financial totaling $1.515 billion. 2. Funds are invested in short-term treasury bills, federal, provincial, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And 3. All of the funds invested during the quarter ended September 30th, 2017 were invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from AHS and PH&N. I so move.
Seconder? Hugh, all in favor? Carried.
Next, the committee considered 5 agreements or amendments or extensions that had contract values exceeding the approval and signing authority of the AHS President and CEO under Policy 1100, Delegation of Authority and Establishment of Controls for Commitments. In all 5 cases, the committee recommended the board approve the agreement and or amendments and extensions as the case may be, and delegate signing authority to the President and CEO. First agreement was the Provincial Clinical Information System Grant Agreement between Alberta Health and AHS for the capital expenditures of the Provincial CIS Initiative. The committee recommended that the board approve such agreement and delegate signing authority to the President and CEO. Accordingly, I move that the Alberta Health Services Board, 1, approve the Alberta Health Grant Agreement for the capital expenditures of the Provincial Clinical Information System for the period April 1, 2017 to March 31, 2022, and 2, delegate signing authority of the Alberta Health Grant Agreement to the President and Chief Executive Officer in accordance with the Delegation of Authority and Establishment of Controls for Commitments Policy. I so move.
Seconder? Brenda? All in favor?
Second agreement was a proposed master services agreement between AHS and Intercare Corporate Group, Inc., with respect to the latter's Brentwood and Kingswood facilities. The committee recommended that the board approve such agreement and delegate signing authority to the President and CEO. Accordingly, I move that the Alberta Health Services Board, 1, approve the amended and restated master services agreement and amendments with Intercare Corporate Group, Inc., and 2, delegate signing authority of the amended and restated master services agreement and amending agreement to the President and Chief Executive Officer in accordance with the Delegation of Authority and Establishment of Controls for Commitments Policy.
Seconder? Richard? All in favor?
The third item, with respect to the proposed amendments to the retail electricity services contract between AHS and ENMAX Energy Corporation. ENMAX has been providing retail electricity services to AHS sites under the contract since January 1, 2016. The combined value of the amendments, along with the initial contract value, exceed the Policy 1100 CEO approval level. The committee recommended that the board approve the proposed amendments to the contract and delegate signing authority to the President and CEO. Accordingly, I move that the Alberta Health Services Board, 1, approve the proposed amendments to the current contract ENMAX Energy Corporation with respect to the provision of services since January 1, 2016, and 2, delegate signing authority of such amendments to the President and Chief Executive Officer in accordance with the Delegation of Authority and Establishment of Controls for Commitments Policy.
You so move?
I so move.
And Brenda seconds. All in favor? Thank you.
The fourth item was the one-year extension to the Lethbridge Family Services Home Services Agreement. Lethbridge Family Services is an experienced home care service provider in Lethbridge and community operating under contract since April 1, 2005. AHS has asked that this contract be extended for a one-year period which exceeds the CEO approval level under Policy 1100. The committee recommended that the board approve such extension and delegate signing authority to the President and CEO. Accordingly, I move that the Alberta Health Services Board, 1, approve the one-year extension agreement with Lethbridge Family Services, and 2, delegate signing authority of the extension agreement to the President and Chief Executive Officer in accordance with the delegation of authority and establishment of controls for commitments policy. I so move.
Thank you. Second? Marlis. All in favor?
The final contract was with Microsoft Canada, Inc. The contract exceeds the approval and signing authority of the AHS President and CEO under Policy 1100, delegation of authority and establishment of controls for commitments. Accordingly, the committee recommended that the board approve such agreement and delegate signing authority to the President and CEO. Accordingly, I move that the Alberta Health Services Board, 1, approve a 5-year contract with Microsoft Canada, Inc. for the provision and support of Microsoft products and services to be executed by December 31, 2017, and 2, delegate signing authority for the contract to the President and Chief Executive Officer in accordance with the delegation of authority and establishment of controls for commitments policy. So move.
Thank you. Seconder? Hugh. All in favor?
As a final matter, the committee reviewed proposed amendments to the delegation of authority and establishment of controls for commitments policy 1100 to formalize the process regarding obtaining necessary approvals for expenditures during the interim period in which ministerial approval of the budget is pending, as well as clarifying the application of the CEO's approval limit. The committee recommended that the board approve the proposed amendments to policy 1100. Accordingly, I move that Alberta Health Services Board approve the proposed amendments to the delegation of authority and establishment of controls for commitments policy 1100 as reviewed by the board. I so move.
Thank you. And a seconder? Hugh. All in favor? Thank you, David, for that very long and fascinating report. That was great. Thank you very much. Next committee is community engagement. Marlis.
Thank you, Madam Chair. The Community Engagement Committee met on November 29th. Thank you. Dr. Ken Sauer, the chair of the Palliser Triangle Health Advisory Council, attended the meeting to discuss matters of importance to his council. The committee appreciated the discussion they had with Dr. Sauer. The committee also received an update on community engagement and foundation relations, including the governance work with the foundations, the status of the Edmonton Children and Adolescent Mental Health Project, and the success of the recent Advisory Council Fall Forum. The committee also discussed LGBTQ next steps and were advised that AHS is committed to providing safer and more inclusive health services for all sexually and gender diverse lesbian, gay, bisexual, transgender, and queer or LGBTQ folks and their families. The committee also considered 3 items for recommendation for approval for the board. First, with respect to the appointment of trustees to foundations. The responsibility to appoint trustees to established foundations lies with the AHS board. Continued foundations, those existing prior to the first provincial regionalization in 1995, and exempt foundations, those created under alternate legislation such as the Societies Act, are permitted to appoint their own trustees without AHS approval, though AHS is able to appoint 1 voting trustee to each continued foundation. We're very grateful for this commitment of our volunteers across the province. We value their work and we appreciate their commitment to healthcare in the province. Given the number of appointments, and the names will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the appointment of trustees to health foundations as reviewed by the committee and the Alberta Health Services Board. I so move.
Thank you. Could I have a seconder? Brenda? All in favor? Thank you very much.
Second, with respect to an amendment to the bylaws of the Grand Cache Foundation, the request to amend the bylaws is in compliance with the Regional Health Authorities Foundation's regulation, otherwise known as the regulation. The Grand Cache Foundation wants its bylaws to reflect the relationship with AHS. Language in the current bylaws references the legacy region, The amendments to the bylaws are for the sole purpose of moving the bylaws into the current foundation bylaw template form that's agreed between AHS and Alberta Health. The committee recommended that the board approve the amended bylaws of the Grand Cache Hospital Foundation. Accordingly, I move that Alberta Health Services Board approve the amended bylaws for the Grand Cache Hospital Foundation. I so move.
Seconder? Hugh? All in favor? Thank you.
Third, with respect to the appointment or reappointment of members to the Addiction and Mental Health Provincial Advisory Council and the Seniors Continuing Care Provincial Advisory Council. Again, we're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health in the province. Given the number of appointments, the names will not be read in this meeting, but will be incorporated into the minutes of this meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the proposed advisory council appointments and renewals as reviewed by the committee and the board for 1, 15 new seniors and continuing care PAC member appointments, 2, 1 new addiction and mental health PAC appointment, and 3, 5 addiction and mental health PAC renewals, including the renewal of Dr. Jeffrey Tagg as the chair of the PAC. I so move.
Thank you. Seconder? David? All in favor?
Just also on behalf of the Community Engagement Committee, we appreciate all of the work that our PACs and HACs do and the foundations, and we wish them all a very happy new year and look forward to working with them in 2018.
Thank you. Thank you very much. Governance Committee.
Thank you, Madam Chair. The Governance Committee last met on November 29th of 2017. The committee discussed various matters, including Bill 27, the Conflicts of Interest Amendment Act, and the effects that that would have on our organization. Also, we received the second quarter Ethics and Compliance Report and met with the Ethics and Compliance Officer. The committee reviewed the updated AHS Board Skills and Competencies Matrix, and we confirmed it would be circulated to members of the board shortly. The committee also reviewed a draft of a new procedure regarding board member remuneration, expense reimbursement, and ongoing education. Finally, the committee reviewed the proposed revisions to the terms of reference for the Human Resources Committee that were mainly housekeeping in nature. The committee recommended that the board approve these changes. Accordingly, I move that the Alberta Health Services Board, 1, approve the revised terms of reference for the Human Resources Committee as reviewed by the committee and the board, and 2, direct that the revised terms of reference be posted on the AHS public website. And I so move.
A seconder? Marlis? All in favor? With that, we're adjourned. Thank you very much.